The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. We have our resident midwife back with us today to chat on another topic. We have Leonora Colon with us from Home Birth Honey here in Austin, Texas. And she is here today to talk with us about labor promoters. How do we get labor moving when we need it to? So thank you so much for being here with us today.
So happy to be with y'all. It's always a pleasure.
Yeah, we're excited to talk about this one. This is a hot topic, both with birthing people and with Ciarra and I. We have discussions about this all the time, and I'm sure we'll get into it a little bit more too. But excited to hear as a midwife kind of what your impression of all this is. So to start us off, when we're talking about labor promoters, I think we also have to talk about due dates. So what do you think about due dates? That seems like such a broad question, but it's an important one.
Also a super hot button topic. So thanks, guys. Here we go.
You're so welcome.
Buckle up.
Buckle up. Got some opinions coming up. As you know, EDD stands for estimated due date. They also say EDC, which stands for estimated date of confinement, which I think is hilarious and very Victorian of them. So we usually write EDD. Obviously, the reason that it is estimated is that when we're looking at going into labor naturally, different people go into labor at different times in their pregnancy. Sometimes when I'm doing a tour with a prospective client or I'm doing a first visit, I'll get into the nitty gritty with the person about their menstrual history and like what medicines they were taking prior to pregnancy and how they were tracking, et cetera, et cetera. And sometimes people might get the impression that I'm getting kind of bogged down on trying to nail down that due date. Because I think that they're going to deliver on their due date. And I always remind, especially first-time parents, that we do not expect them to go into labor on their actual due date. It's like 5% of moms that wind up doing that. So we like to have that due date, especially with some solid dating criteria. Like, yes, I was tracking my periods regularly. Yes, I know, what dates we had sex on or what date the embryo transfer was or whatever. Because if you were to go early, we want to make sure that, you're not 5 weeks early, you're 2 weeks early, that there's a big difference there in prematurity in terms of what's safe to deliver at home. And even if you're at the hospital, they want to know like what type of baby they're going to be delivering. Is this baby tiny and needing respiratory therapy or, a robust 37-week baby? And then in terms of going late, this is where the topic gets a little bit more heated. We do love to see our clients have their babies with us by 42 weeks. There are definitely midwives in the community that are kind of like, whatever, y'all do what you want to do. We'll just wait for the baby to come. And I think that is a reasonable stance to take as long as you are informing your clients of the risks associated with going that far past your due date. The risks statistically are not massive. It's not like you hit 42 weeks in one day and you see terrible outcomes. I will say the majority of the births that I have seen happen after 42 weeks have not been the gentlest, sweetest, easiest vaginal deliveries. Some of the concerns associated with that are going to be decreased amniotic fluid. Also, the baby's head has all of these little bones that haven't melded together yet, which is actually the mechanism by which they're still able to be born, is the molding of the head. And the farther past 42 weeks they get, the less the head is able to do that. So the head can get, pretty squashed on the way out, which can cause the baby to pass a lot of meconium or get stressed out. So what we like to do to help our clients make those decisions is talk about those risks associated with going past 42 weeks, but also offer some extra surveillance at the end of pregnancy in the form of ultrasounds. If we are able to offer our clients biophysical profiles, which is a type of ultrasound where they're looking for criteria that help them to know that the baby is still healthy, the pregnancy is still healthy, still a good idea to stay pregnant. They want to see baby's movement. They want to see normal amounts of amniotic fluid. They want to see these little practice breathing movements. They want to see that the placenta is still looking good. All of these different factors put together into a big report. We get it. It says, great, 8 out of 8. That baby's healthy. That baby's happy. You can stay pregnant a bit longer, and that's probably a fine thing to do. The biophysical profile isn't like somebody handing you a certificate that says nothing bad will happen to your baby in the next 24 hours. I've seen bad things happen to babies after a biophysical profile, but it is a great way to check in and get a good idea of the overall health of the baby and the pregnancy. If somebody is like passionate about not having any interventions and, going as far past their due date as needed, there are definitely people in this community who can support you with that goal. The 3 midwives, myself, Meg, and Brittany, that comprise Home Birth Honey, we all worked in a high volume practice. And so we saw lots and lots and lots and lots of moms. And that helped us to develop kind of a parameter of what feels safe to us. So we want to make sure that while we are supporting you and your goals and making sure that you're able to make these choices for yourself, there are certain factors that feel unsafe for us and make us feel like we're going outside of our scope of practice as certified professional midwives. So we do have a protocol that is to try to help people get delivered by 42 weeks. Sometimes we can push it a tiny bit here and there on a case-by-case basis, but ideally get that baby out by 42 weeks. I will say, as a mom who went to 41 weeks and 5 days with my pregnancy, and helping, thousands of other moms out there, most people are pretty excited to get the baby out by that point in their pregnancy and like not super excited about the idea of just like waiting indefinitely. So that tends to be, a pretty popular take to help people. But that's basically where we are on due dates.
So just for our knowledge, are there rules that you guys have, like through whatever regulatory agency is over you as midwives, where you're not allowed to go past a certain point? Or is that within the realm of decision making for the midwife based on the individual?
It's definitely not encouraged to go past 42 weeks, but it's not something that is likely to get your license taken away from you.
As long as nothing bad is happening. As long as it's an okay outcome and nothing is brought up about it. Okay, I was just curious because I've heard both ways. I've heard that like you're allowed to do what you want. And I've also heard like, no, I could risk my license being taken away simply by being at a birth past 42 weeks. So I kind of wanted
There's this interesting conundrum where we used to be, I'm putting allowed in quotation marks because there is some flexibility within, what we do, but allowed to attend labor starting at 36 weeks. And then I guess a deal was made potentially that traded that for vaginal breech delivery. So now we're legally able to do vaginal breech delivery, but they want us to only do deliveries after 37 weeks, which
They're not even related.
I find it to be totally arbitrary. When I was at the birthing center, if we had a certified nurse midwife sign off on the chart, we did deliveries after 36 weeks, as long as there were no other significant risk factors. I don't have any problems delivering a 36-week baby, that you just counsel the parent that, they're more likely to have breathing problems and that, you might need to go to the hospital for respiratory therapy afterwards. But the birth itself, rarely an issue.
Because at 30, if you are spontaneously going into labor, like just for the people that's listening, they're like, oh my gosh, 36 weeks, that's a whole month before my due date. If you're spontaneously going into labor at 36 weeks, then your baby and your body has signaled that it's ready for delivery. And yes, there might be something else going on that makes that happen, but we're not talking about an induction, forcing a labor to happen at 36 weeks. This is a totally different story.
I think that's true. Also, people do have premature labor that, I would say is not meant to happen, but
yeah, absolutely.
But yeah, I've helped out a lot of people at 36 weeks and I have not yet had a bad experience with that. Past 42 weeks, I've seen some stuff. So yeah, I think that sometimes when people are, talking to birth workers and specifically CPM, certified professional midwives, they forget that we are human beings who also have boundaries. We are very focused on the client, on their partner, on making sure that their wishes are respected. And, I always want the families that I'm helping to feel that they have autonomy in the process. But I do also have boundaries about what I'm willing to, lay my license on the line for and what feels like too much. We got a 1-star Google review from somebody who had not used our services, that said, Home Birth Honey brings the hospital practices to your home.
Okay.
Because in a Zoom with her, a free Zoom consultation, we told her that we don't like going past 42 weeks.
Wow.
So, we had like great Google reviews and then it like dropped us down because of that 1-star review. I'm like, I didn't even like, hell, you didn't get any of my money. All I did was give you a free Zoom,
Yeah. And it's not like they hired you and then you like, bait and switch,
bait and switch. Exactly.
Yeah.
And that's what I said. I was completely honest with you about the way that we practice. If you had asked me for midwife recommendations on midwives who go past 42 weeks, I would have gladly given them to you. A lot of times when I do those Zooms, I try to match people up with midwives who are better fits for them in terms of like, what specific goals they're looking for. But, I have my boundaries, my team, we all have our boundaries, and we do that to keep our clients safe. And we also do it to keep ourselves safe.
Yeah.
Yeah.
So, I mean, there's also just a lot of like, I think, people don't recognize as well, you talked about like the mental health aspect, but for birth workers, like it's a lot mentally for us. And so sometimes we do have to put up boundaries that, may not make sense to people, but that's how we can continue serving families. And we can't continue serving families if we are on the verge of burnout all the time because we're in these situations that are very, very stressful. So,
and we tend to be empaths. A lot of us in this work are empaths, which makes it very doubly hard. So as a hypnobirthing educator, I always struggle because there's a fine line between promoting labor and stressing people out about going into labor. So like you can go into 42 weeks, but then at some point someone's like, well, if you try these things, maybe it'll help you go into labor. And you're like, I thought I had until 42 weeks. So as a midwife, how do you ride that line? And how do you feel about kind of natural at-home labor promoters? And when should you start them if you should start them?
I want to say I totally understand both sides of this. The idea that like we don't want to stress somebody out and make them feel like them going into labor is dependent on the things that they do at home, like homework. But I also like to help people feel empowered and to know that there are things that you can safely do that, are not likely to send you into rip roaring labor, but that can help your body to kind of ease into that process and get a little closer to ready. So I'm going to talk to you guys the way I would talk to a client who I was doing like a 38 or 39 week prenatal visit with. I would say, how are you feeling about labor? Are you feeling ready for birth? And sometimes they'll look at me and be like, I need a week, or I need like 2 weeks, or, whatever. They're wrapping stuff up. They're not mentally there. And I'm like, great. And then I talk to them about things that they can do to promote relaxation, especially in the evening time. Now, I do consider that a labor promoter, but I'm not pitching it to them as a way to go into labor. I'm pitching it to them as a way to decrease their cortisol levels, increase melatonin, increase oxytocin, all of that hormonal process that helps them get closer, but also helps them to feel better. Sometimes doing a 38 or 39 week visit, the person looks at me and they're like, I'm miserable. I'm not sleeping well. I have heartburn. I have indigestion. I just really, really want to meet the baby. And I'm like, cool. Would you like to know some things that you can do that might be helpful to, not have another 2 weeks of pregnancy? And usually they're like, yes, please. Or they bring to me, my friend told me to take this supplement or do this or do that. I'm going to go through my favorite things to recommend. And the number one favorite thing is a really solid bedtime routine. So that's going to include taking a bath, if you like baths, taking a shower, maybe listening to some meditation or some hypnobirthing meditations. I always, if the partner's there, I'm like, rub on her feet, rub on her shoulders, help her to feel relaxed in the evening time. Take your evening time supplements, your magnesium, your fish oil, whatever it is you take in the evening time to help promote rest. Because again, that's really going to help them hormonally decrease that cortisol, which is kind of the enemy at the end. But in addition to that, you can drink red raspberry leaf tea. You can have a cups of that every day. You can do curb walking, which actually I find curb walking to be pretty legit. You can be getting any and all body work, massage, chiropractic care, acupuncture. It's a great time to be taking extra time to help your body relax. I do not think that dates are the move. If you love dates, if you are like, yum, yum, I want to put some dates in my smoothie, or I want to like wrap it up in bacon and put some goat cheese on it, have some dates. They are absolutely delicious. They are so high in sugar though. And I have people who come to me having their first, their second, their third baby, and they're like, I'm jamming 6 to 9 dates a day because I want my cervix to be ripe. And I'm like, here are the things that will ripen your cervix: a baby's head sitting on top of your cervix, intercourse, especially if there's any semen involved, not to be gross, but there are prostaglandins in semen. And if you're really worried about it, especially like as a first-time mom, you can talk to your midwife about evening primrose oil, about different ways that you can use that. We used to recommend evening primrose oil like across the board at the birth center, and we noticed we were having increased rates of waters breaking before labor. So we did pull back on that. But I would say if you're 41 weeks pregnant and you're just dying to have a baby and you want to use some evening primrose oil as lubrication for intercourse, I don't think that's a terrible idea. I don't think that's overkill. I don't necessarily recommend that you just do like vaginal suppositories of it all the time or take it a bunch, again, because of those increased rates of broken waters. But that's there for you. Eating a bunch of extra sugar at the end of your pregnancy is not the move.
Yeah, I've heard like multiple angles on this, because then I also heard somebody talking about how, because I was like, oh, well, if somebody is gestationally diabetic, to me, with my novice brain and non-medical mind, I'm like, well, you shouldn't do that, right? But then someone was talking to me about how it doesn't affect the glycemic index in the same way. So I've kind of heard mixed reviews, but we actually have a podcast episode called Birth Prep that was one of our most popular episodes. It's been listened to one of the highest rates. And it was just Sam and I kind of going through the pros and cons of each of them. And we talk about the red raspberry leaf tea and the primrose oil and the dates and all of those things, and kind of the evidence on both sides, because you can find evidence on whatever you want, really.
Yeah.
But it is hard, because when we're recommending these things, as someone with my second baby, was having an out of hospital birth, and I knew I was going to risk out on timeline if I didn't hurry up and have a baby. I didn't want to go to 42 weeks because I didn't want to risk out and have to go to the hospital. But then I found myself like pressuring myself and raising my cortisol, probably by trying and doing all of these things.
Absolutely.
And I ended up taking castor oil and like all of it. So, how do people know when to start some of these things?
I strongly recommend you talk to your midwife about it. They're going to be the best resource. If you're with an OB, they may or may not have some ideas about that. They're probably going to recommend like intercourse, and maybe castor oil in some cases, not likely. My practice, we actually have a protocol for people who go past 41 weeks. We love to offer that biophysical profile at 41 weeks, just so we can check in and make sure baby's doing well. The things that are also available to you past 41 weeks are going to be membrane sweeps. A membrane sweep is when your provider puts their fingers into your vagina, and gently massages the cervix. What happens with that, and I'm providing a little visual aid, is that you are separating the membranes from that area that's kind of stuck on with, behind the or in front of the baby's head. And it releases prostaglandins. It tends to soften the cervix a little bit. Sometimes I'll feel the cervix release a tiny bit while I'm massaging it. A lot of times people will come to me and they'll be like, I do not want a membrane sweep. And I'm like, totally, like, do you, like, this is all about you. But like, talk to me about why that is. And they'll say, well, I've heard it's really painful. A membrane sweep should not be painful. Your provider should take the time with you to allow you to relax, to allow your body to, take some breaths. Even if your provider is not taking those steps with you, I recommend that you take those steps and say, wait, I'm going to take some breaths, and then you can go. And then you take the breaths. Your provider should tell you what they're doing. Okay, you're going to feel my fingers. You're going to feel some pressure. Okay, I'm feeling your cervix. I might have to apply a little bit of fundal pressure to the top of the belly to help bring baby's head down so that I can reach behind to reach the cervix. If I can't reach that cervix, if it is so far behind the baby's head that I can't reach it, it's probably not going to be an effective maneuver. So I'm just going to go ahead and say, okay, let's try it again next week or in a few days. But more than likely, I'll be able to feel the cervix, do some slow, gentle massage, which it doesn't feel great, but again, it should not be painful. Most it should feel is kind of crampy, pressury, uncomfortable. Breathe with it. And then, the provider takes their hand out, and, sometimes you'll see a little bit of bloody show on the glove. Sometimes there'll be some mucus. I do find membrane sweeps to be a really helpful, useful tool when we get late in the game, when we get to that point where, either this mom is really eager to go into labor, or we're, starting to butt heads with that 42-week mark. And I find that the more effective way to offer them is daily. Now, not like every day for 7 days or anything like that. But if you get to the point where there's already some uterine activity, they're already showing some cervical mucus, maybe their evenings, they're really crampy, doing a membrane sweep. And then if they're not in labor the day after, offering it again, I do find that to be a very, very effective tool.
Yeah, absolutely. I remember when I was pregnant with my daughter and I was at the birthing center, and at the same time that you were there as well, I was on a lot of that same protocol. That was the time where evening primrose oil was recommended, so I was doing that. I was doing all these things, but I was having the absolute worst prodromal labor, and even though I was not, I was before my due date still, I came and talked to my midwives and was like, hey, like, is this an option? I have all of this going on. I like, could we talk about a membrane sweep, before that 40-week mark? And you all were able to, the midwives there were able to, look at me, look at my individual situation and have a conversation with me about what made the most sense for me. And I think I had like 3 membrane sweeps in a week, and I had my baby on her due date, day before her due date, which was wonderful. But it was a very like individualized process for me. It was not a like, oh, sure, you're 39 weeks and tired of being pregnant. Like, yeah, let's just like get the show on the road. It was okay, we have all these other things going on. You're having prodromal labor every single night. Since you were 36 weeks pregnant, like you're not sleeping well, there's all these things going on. Maybe it would make sense to see what we can do. And that was great for me, whereas it may not be great for other people.
Absolutely. And if somebody does not want membrane sweeps, that's fine. You don't have to have membrane sweeps. We have another tool at our disposal, which is castor oil. We do not recommend that you go off books and take castor oil with some recipe you read online just because you're tired of being pregnant. If you are planning to take castor oil, please talk to your midwife about it. I have seen some truly insane recipes on the internet for, midwife's brew or, whatever they're going to call it. I saw one that called for 10 ounces of champagne and almond butter and apricot nectar and castor. I'm like, is the goal to make them throw up? Like, ew.
I had a home birth once where she had me go get tart cherry juice and all of this stuff for her midwives brew. And we were supposed to do that because we were trying to get labor to move on. It was already only 8 minutes apart. We were just trying to get them together. But it is interesting because you say ask your midwife, but what stinks is that we have so many clients that have OBs and they are hard and fast against this. And then they do end up going off books, not at our recommendation, but they do because they're like desperate to go into labor, Well,
I'm going to tell you, if you are just going to do it anyway, no matter what, there are some things that you can do that are going to make it safer and make it less likely for you to vomit up whatever you just drank. Our tried and true method is a scoop of ice cream, the amount of castor oil that is recommended to you, which is between 1 and 3 ounces. 3 ounces would be a lot. So we're talking about titrating this to somebody's body size, to whether or not they're already having contractions, to whether or not they have a sensitive stomach, to whether or not they're willing to take subsequent doses. And then just a splash of milk, put it in the blender, basically turns it into a milkshake, or you can do it with like a popsicle and fruit juice instead. You want the least amount of stuff in it that is going to taste good and not make you throw up. The more that you drink with that castor oil, the more likely you are to throw up, or that it's just not effective in your system because it's diluted by, 8 ounces of other stuff.
That's interesting. I didn't think about the diluting it. I'm having flashbacks to when I did this because I threw everything at the wall to see what would stick because I just really I went to 41. I only went to 41 and 2 with my second, but again, I was terrified of risking out. And I have a video because my husband is old school and like literally got an old school video camera to video things. He's the biggest dork in the whole world. I love him so much. And he was videoing me drinking this castor oil, but I'm kind of hardcore. Like I'm all or nothing. I'm doing it or I'm not. And so I just took a shot of it. Like I'm not mixing it. I'm just taking a shot of it and it gets stuck. Or maybe I mixed it with a little bit of orange juice, but not much. And it like felt like chapstick on my lips. My face was just awful because we have it on video. Thank you, Kyle. And my daughter like brought me a cookie and was like, "Mom, you deserve this after you just did that," And it's miserable. So ice cream sounds so much better.
Crayons. Like
melted crayons.
People are like, oh, what's it taste like? It's not like a taste that's abhorrent. It's just it smells like melted crayons. So you need something that's gonna, and if you're not gonna do, like a shake, you could do it with OJ. But the thing about castor oil is that it can cause strong, frequent contractions to the point where your baby really should be monitored. So this is why we don't recommend that people just go off and do this on their own, because it can stress out the baby.
And fiery poops.
And fiery poops. Well, the poops are kind of
and
the
you get
point.
dehydrated. But then
Yeah.
but then people can get so dehydrated, right? And then you might be having contractions that are really just like your uterus going, "Oh, we're so dehydrated," right?
Exactly.
So it's
Yeah,
like
so you have to
this
be careful with
balance.
hydration. It's not ideal to be doing on your own. I understand if you're with an OB and they're saying like it's either induction or nothing, like you're definitely wanting to try out some different things. So if that's the case, if you don't have a provider who's supportive and you're wanting to like go off of books, I would recommend it in 1 ounce increments with no more than 3 ounces total over a period of many, many hours. But if you're feeling strong contractions, immediately going in and getting checked out, because that really can stress out baby. And I don't think I would recommend doing it without help. But I also wouldn't recommend an induction out of the blue, which a lot of people find themselves in that position of having to either break up with their provider or go in for a non-evidence-based induction. So that's understandable. We use the castor oil kind of as our last ditch effort, because it is so unpleasant. We would rather do 18 other things to try to help you get there than that one thing. But I've had so many moms deliver after taking castor oil and not have to go to the hospital that I don't rule it out.
I agree. I'm kind of a fan, like when it comes to that last ditch effort. I have very rarely, if it's done with a provider that's saying that, yes, it's okay to do it and we're going to keep an eye on you for this, very rarely is it not effective when it's that last Hail Mary attempt. So I like it.
The other thing is the timing of it. I usually recommend, if it's not like time sensitive to the hour, like you've got a matter of day or so, taking it like waking up a few hours before you would normally get up and doing it then, and then going back to bed. Because for some people, it'll take hours and hours for it to work its way through your digestive system. And if you take it right before bed, that's a long night. That's not the vibe. Definitely don't want to.
So glad you said that. I didn't even think of that, but we say the same thing. We're like, no, you just got done with your doctor appointment at 4 p.m. and they said, yeah, or midwife or whatever. Don't do it now. Like try tomorrow. Like let's not have a party tonight.
If you're the type of person that can like get up like either in the middle of the night or early morning and go back to sleep, that's the best way to do it. If not, just upon waking up.
Yeah, for sure. We like well rested. Also, like you were saying earlier about the hormones, melatonin, then oxytocin, if we can get that boost overnight and then wake up and see what we can encourage, that's always going to be more beneficial. And nobody wants to start laboring when you are absolutely exhausted too.
Yeah.
So what would you say, and I know we kind of covered this a little bit as we talked, but what would you say to someone who's interested in labor promoters, but really isn't sure where to start? Maybe they don't have a super, supportive provider that's giving them a lot of this information. Where would you encourage them to go?
Well, if they are with an OB, I hope they have awesome doulas like you guys that they can talk to about this. Now, doulas technically don't need to be like giving out medical advice. But I think that when it comes to innocuous options like intercourse, gentle nipple stimulation, not throwing on the breast pump for 3 hours straight, but just like stimulating your nipples while you're being intimate with your partner, curb walking, going on the Spinning Babies website and looking at like stretches and exercises you can do in late pregnancy that help promote good baby positions, chiropractic care, acupuncture, massage, red raspberry leaf tea. Like I said, none of those are going to put you into rip-roaring labor if your baby's not ready to be born. A lot of times people will be like, well, I want to do some of this stuff, but I'm just not ready to go into labor. And I'm like, you're not going to go to acupuncture and go into labor if your body wasn't already ready to go into labor. It just helps to kind of get you there. I'm a huge fan of acupuncture. There are some amazing acupuncturists here in town. And like, I felt like when I was pregnant, it was almost like mental health care for me. Like I felt kind of cuckoo, and my acupuncturist was really magical and wise and amazing. And she really helped me to feel more normal. Shout out to Peggy Gorbani at Central Family Practice. But I encourage people to do things they want to do. Sometimes I'll talk to somebody and they're like, I'm doing all this stuff and I feel exhausted. I'm like, why? Like, take a break, take some time, go get a pedicure, go to one of those like foot rub places, I remember walking into one of those foot rub places at like 1,000,000 months pregnant and just like pointing to my belly to the ladies, and they're like, yeah, we got it. We'll do the things.
Let's go. That's one of my favorite things to talk to people about at my prenatals is come up with your like end of pregnancy bucket list, like all of the things that are going to make you happy. They're going to make you feel good. Plan an awesome date night, go get a pedicure, have, a game night with some friends, like those things that are going to be a little bit harder to do once you have a newborn. Yeah. Plan some of those things, space them out at the end of pregnancy so you have things to look forward to. Yep. And just do these things that make you feel happy. And, things like massages, things like acupuncture, reflexology, going to the mall. I lived at the mall because I was pregnant in August.
I feel that.
Children and
or go swimming, like whatever your thing is.
Yeah.
I think it's also on a case by case basis, because some women I talk to are doing the most. And I'm like, you actually do not need all of these things on your books. You need to like cancel all this and like have some like home movie nights and chill out. And then the other ones who are just like sitting looking at their phones for like 2 weeks at the end, I'm like, you need to buy movie tickets. You need to go for a walk at the mall. You need to go for a swim. You need to have a date night. Like it's just, it's like the people who don't want to do stuff like need to do stuff, and vice versa.
Yeah, I think that is exactly why I have such a fine line on we're really having to feel out our clients. And like you said, we should not be giving medical advice, and we're not. If we give anything, it's more of these are some of the things that we have seen people do that have worked. You can try some of these. You can ask your provider about some of these so that they at least know what the options are out there. But my favorite ones are the ones that make it so that you can induce your own natural oxytocin. Have sex with your partner, have sex with yourself, have nipple stimulation, hand stimulation. Even if you're putting on a pump for 10 minutes because you're like, I can't sit there and touch my own nipples, whatever, fine, but like not for very long. Watching movies that make you laugh, all of those things that make you feel good, getting a massage, things that make you happy, things that make you laugh.
Cuddling with your pets, cuddling with your kids. Yes. And if you don't feel like sex, you don't have to have sex. Right. Literally just like being skin to skin with your partner does
only
something.
What feels good, only what makes you happy. So those are a really great place to start. And then maybe you have to add in some of those bigger guns in the end. But this is so helpful. Like we have people all the time ask us about this stuff. So we love it when they can hear it from somebody who does have a little bit more knowledge and experience behind them for these topics. So we will have you come back again, of course, because you're a resident midwife. You didn't know you were signing up for that, but buckle up. That's who you are now.
I'm into it. None of this is medical advice, by the way.
Hashtag, okay, we have a disclaimer at the very beginning. Nothing you hear on this podcast is medical advice.
But also, if you're with an OB and you're at the end of your pregnancy and you're feeling just like every single thing I bring up with them is getting dismissed, call a midwife. Like they're not going to be able to give you medical advice, but you might be able to form a relationship that is beneficial, that feels supportive. And even if you don't change your birth plan, even, if you have a need for delivering at the hospital, you might be able to get some extra support. And there are midwives, including my practice, who will provide prenatal care and postpartum and newborn care and do a planned hospital delivery. So if there's a reason that you have to be there, but you would like that extra level of support, that's an option too.
Absolutely. I love it. Okay. Well, thank you so much for coming, and we will talk to you soon.
Thank you. Bye.
Bye.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.